When I was in medical school, I'd come upon a book that was written by the president of the American Allergy Association at that time. His name was James Brenneman. And he had a sentence in there that I thought was very profound. And it said that food sensitivities or food allergies don't cause everything, but they can cause almost anything. And it kind of stuck with me. When patients come in with chronic symptoms, we often will check them for sensitivities or allergies. Now, those two terms, allergies and sensitivities, are not completely identical, but for the purposes of my practice, we treat them basically the same. In a more traditional medical setting, they only see an allergy as what we call an IgE, which is an immunoglobulin E mediated response. For example, those who eat a peanut or a strawberry or have some chocolate and they blow up and they get hives and they may have asthma attack. And it's very, very serious. I'm not talking about that. So we're checking people for intolerances and sensitivities to foods, to inhalants, to chemicals, to danders, to even hormones sometimes. You could be sensitive to your own hormones, believe it or not, that are causing problems. When we have people with chronic fatigue, fibromyalgia, chronic headaches, gas, bloating, gastrointestinal complaints, I almost always check these patients for sensitivities to more than just foods or eating. As I said, we might check mold can cause, for example, depression, and anxiety and sleeplessness. If you're exposed to weeds and danders and trees and grasses during certain times of year, of course, we know we can get rhinitis and congestion and sinusitis. They can also cause us to even feel fatigued and have joint discomfort. When I have people with chronic symptoms of almost any sort, I will often test them to see, are there triggers that are contributing to their symptoms? So rather than just putting them on like an antihistamine, which is traditionally done, or steroids, which I don't like at all because there's too many potential risks and side effects, plus you're just covering up symptoms. We're looking for root causes. And also I should say too, the gut plays a big role with that too. If you have leaky gut syndrome, which means the GI tract, the gut is too permeable and it's allowing things to get into the body that shouldn't. For example, what's called macromolecules, large molecules from proteins in particular, because they're not being broken down properly. Those two can cause us food sensitivities and food allergies, and overgrowth of abnormal bacteria can do the same thing. So part of our evaluation is not only assessing each patient individually for sensitivities and allergies and intolerances, but also looking at the health of their GI tract, which is paramount to also treating them as a whole person systemically. And it's an area that, is missed too much, I think, in conventional medicine. They're just too quick at writing a prescription because they only get 5 and 10, maybe 12 and 15 if you're lucky, minutes to treat you. But if we have an hour, which I do with our new patients, and I can spend time and tease out what are the areas that really need to be evaluated on that patient and come up with a personalized approach for their allergies and sensitivities.